Good morning, one and all, and I hope you are all doing well on this fine Saturday morning. I am Rosanna Pike, the Health Education Officer for the Global Health Advocacy Project at the Heart Foundation of Jamaica. So on behalf of the Healthy Caribbean Coalition Youth Group and the Healthy Caribbean Coalition itself, the Jamaica Youth Advocacy Network, the Heart Foundation of Jamaica, the Jamaica Health Advocates Youth Arm, the Barbados Childhood Obesity Prevention Youth Advocates Program, and the Heart and Stroke Foundation of Barbados. And last but not least, the University of Technology's Association of Nutrition and Dietetics students. It is my pleasure to welcome you to our two-day workshop. Right now, there are over 34 participants on the call from across the region. And although we are oceans apart, there is one thing that we all have in common, and it's that we care about the health of our Caribbean people. So you're in good company because all of the youth that organized this conference, specifically for healthier food environments, where it is easy to make healthy choices, they are all these organizations, they're youth-led, and we are just trying to build capacity with you being here present to amplify our messages, to get policymakers to make those necessary actions to actually help to create healthier future for our Caribbean populations. So another thing that the organizations have in common, and again, I think all of us in the call, whether you're a youth or a part of some youth organization, a youth network, or you're a youth at heart, is that you think it is important for youth to be involved in dialogue about healthy food environments. So no one knows this better than my very own co-host, Ms. Christina Williams, who is a passionate health advocate and has represented Jamaica on regional international stages demanding better health, especially for those who are most vulnerable, including children and youth. So help me to give a warm welcome to Christina Williams.
Thank you so much, Rosanna. And I also just want to big up everyone joining us from your different countries, whether you're joining us from online or you're joining us from in person. So I'm just going to ask you real quick to just drop in the chat, where exactly are you joining us from today? So just real quick, drop in the chat. It could be a flag, you could write it out, and of course, give us a fun fact about your country. And because I'm really jaminating today, because I am from Jamaica, I have my flag here. So I'm actually not joining from Jamaica. I'm actually right now in New York City at the UN General Assembly, but I still feel the Jamaican vibes right now. So I have my flag and I'm excited. And I really hope all of you today are also excited to be here for this workshop, because trust me, guys, I have the secret. Like, it plans to be really, really exciting. So I see Kay saying St. James, Jamaica. All right, my fellow Jamaican. All right, keep it coming, keep it coming. What country are you joining us from? And one fun fact about your country. So one fun fact, because I'm a foodie and we're talking about health, is that Jamaica has the best jerk in the world, and specifically Portland, where I am from, has the best jerk. Anybody here agree? Well, if you disagree, don't put it in the chat, because that's the truth. There's no argument about that. Jamaica has the best jerk and Portland has the best jerk. So keep dropping the flags in the chat as well. Nassau, Bahamas, nice to meet you, Kaj. Hard disagree on Portland, Sean? Shanique, really? Okay, all right, I won't argue with you. So I would like to ask Rosanna though, like, why are we all here? And why is it important for young people to get involved in solving this problem about non-communicable diseases, about health in the region? Why is it important? I mean, we have doctors, health professionals, we have all these different persons involved in the healthcare sector that are supposed to be the ones solving this problem, the politicians, the health professionals. Why do we need young people involved in this process? Rosanna?
Right, good question, Christina. So Really and truly, urgent action is needed by multiple stakeholders, including our youth, to raise the alarm about the need for a healthy environment, particularly the need to implement and strengthen relevant healthy food policies, and not just healthy food policies, but make sure that they are scientifically evidence-based, right? And why youth? Because youth are members of schools and wider communities where healthy or unhealthy habits are formed and grow. And youth now have the ears of policymakers and voices in policymaking spaces through youth parliaments and similar fora, so they can advocate for change that will impact generations to come. So let's be real, we can recognize that our youth, or us as youth, are change makers, and young people can share their lived experiences and perspectives to help influence their environments and, of course, policies. And they can also hold policymakers accountable to their promises to help shape healthier food environments in the Caribbean. So youth voices, in a sense, are invaluable to society, and we appreciate that all of you that are here with us today took your time to come on to learn about an issue and, of course, the solution. And these issues, of course, are health related, right? And the solutions, the wide array of solutions that are readily available for our policymakers to draw on to help to mitigate the problems that are associated with these issues. So we want you to feel equipped, right? So Christine, I'm gonna ask you now to just tell the attendees, those, or participants online, what they will learn over the next couple of hours that we'll be on.
Thank you so much, Rosanna. So as she mentioned, youth have to be a part, or youth has to be a part of the process. There's nothing for us without us. And of course, health affects us. And having you here, it's important for us to talk about NCDs, non-communicable diseases, and talk about how it is that we have to transition with our health policies to meet the issues of NCDs. Do you know, guys, that 70% of the deaths that we have in the region are actually attributed to NCDs? Did you know that? 70%. So can you imagine that? So it's very important that we have this conversation and this transition toward policies and programs that will target NCDs and other health-related matters. And then we look at the fact that we have health nutrition policies. Jamaica right now is going through a phase of consultations on the school nutrition health policy. And there are other countries as well that are other Caribbean countries as well that are also looking at that. Some have already implemented theirs. And so you're seeing this gradual transition, as I mentioned before, as we try to target NCDs. We're going to look at the role of youth in advocacy. And we just mentioned nothing for us without us. There also has to be youth accountability. So we also have to be a part of that conversation that are demanding better health policies, better health programs, demanding more from our governments, more from our health professionals. We're also going to be looking at how young people have been advocating for healthier environments across the region. And I'm sure we're going to be hearing from young people from different countries and the exceptional work that they have been doing, the impact that they've been having. And personally, I am looking forward to that. Also, the tools that you can use in your health advocacy. So some of you on the call may not necessarily be health advocates, but let me tell you something as somebody who's also an educational advocate. Everywhere that I go with my education advocacy, I also raise the point about ensuring that school environments are healthy for students, because you cannot, any shape or form, learn in a way that I would say can make you be a good contributor to society. You can never truly learn properly in an environment that is not healthy. Whether we're talking about physical health or mental health, emotional health, you have to be healthy in order to learn. So as an education advocate, I mix it up in there. And so as a person on the call today who may not necessarily be a health advocate, you can also learn about the tools that you can employ in also integrating health advocacy into your work. Also going to be developing SMART activities. Anybody can guess what SMART means? Specific, measurable, attainable, realistic, and time-bound. Yes? Right, develop SMART activities for healthier environments. So we're talking about ensuring that we're demanding for things in a very specific way. We want this particular policy implemented by this particular time, and also this particular results, so we can see this particular impact on our societies. So as you can see, a bag of things. I'm using the Jamaican phrase because, as once again, we are using our Caribbean vibe. We have a bag of things, a lot of things planned for you. at this workshop. And so I'm just asking you to just let yourself go, you know, get in the vibe, open up your brain cell, as my grandmother would say, and just learn as much as you can and share as much as you can today at our workshop. So, Rosanna, I heard we have an icebreaker. You ready for the icebreaker, guys?
Right. So yes, we do. And guys, so bear with us. We're trying to make this session as interactive as possible while we are equipping you with a number of tools, as well as expanding your knowledge on information of, you know, how to create healthy food environments through scientific evidence-based policies, right? So now we'll have an icebreaker. It is called Would You Rather? And at this time, I'm going to invite Shanique Bowden. She is the Executive Director of the Jamaica Youth Advocacy Network, and she will explain to you the rules of this game. All right, so Shanique.
Okay, good morning, everyone. You do one icebreaker and then suddenly they want you to do all of them. So essentially, most of you should probably be familiar with Would You Rather. We're going to give you two options and you're going to chime in the chat to say which of the two you'd prefer. And I mean, they're a bit fun. I was just looking through the options and I was just like, these should be very exciting. And if you can type fast enough, you can also tell us why you'd prefer one over the other. And we're just using it as an opportunity to get to know you a bit, to see what people like, and to see how best even some of the responses based on what we get can inform what we're going to be doing after today. So essentially, once Rosanna shows the two items on the screen, you can just let us know in the chat which one you prefer, which one and why, which one you prefer and why, or which one you'd rather to have and why. Right, so we have tea or coffee. Let us know in the chat, are you a tea person or you're a coffee person? I'm a tea person, not a fan of coffee at all, but I love tea. A good chai really gets it going for me, you know? Okay, I'm seeing a lot of tea, okay. Okay, coffee puts me to sleep. Coffee also puts me to sleep because I keep hearing that it's supposed to give you that caffeine boost. So like when I was in university, I started drinking coffee and I was just like, no, I'm just gonna go to my bed. So we see some people, and you know, Christina said she loves Milo. Just recently on Twitter, on Jamaican Twitter, as they call it, there was a big discussion about Horlicks versus Milo and which one you prefer and all of that. I'm team Milo. Horlicks just doesn't slap like it needs to. But it seems overwhelmingly we're a tea group. No hate to the coffee people, but we're a tea group. This is a tea safe zone, right? Okay. Alex, Milo, Claudia is coffee. Yeah, so we have quite a few coffee, but I would say the tea wins this round. Sharika's now getting into leaves and beans, and we don't need all of that. We don't need all of that confusion right now, Sharika. But yeah, we're definitely tea people. So we can go to the next one. Okay, are you a public speaker? Are you a writer? If it comes down to how you think about when you want to do your advocacy, do you want to write a letter to express your grievances, or do you want to go out on the media to speak about it? Public speaking, I mean, okay, Christina, public speaker, I wouldn't expect anything less. Stacey is a writer. I think I'm also a writer, but I've also been forced to speak more than I would like to. Case in point right now. I'm kidding. Sharika is also a writer. Jenny, public speaking. Shelly says it depends on the day, but she leans more towards public speaking. Alex, both. Who else am I seeing? Azaria, writing. Onika, writing. Okay, I'm getting a mix. I want to say writing is winning, but I'm getting a mix. Mix of both. Anyone else? Last chance to let us know if you're public speaker or you're more of a writer in terms of your advocacy. Rosanna says block road and demonstrate. Taj, I hope I'm getting that right, is a writer as well. Jahil, writer. Okay, so we have a good balance. So and that's good. because, you know, we have to play to our strengths. And if writing is your strength, definitely write. If public speaking is your strength, definitely we know we can put you as the face of the movement to make sure that you can really amplify what is the advocacy that we're going for. And it works hand in hand. Perhaps I will write it and you will say it and that sort of thing. So we all need each other in this advocacy game. Kayla is a little bit of both. All right. Are you a river person or a beach person? I'm solidly a river person, mainly because the beach, I don't like the sand and the salt water in my eyes, and it just gets a whole inside person. That's my first choice. If that was an option, I'd be an inside person. But given this, river, definitely river person all day. All right. So we have a bit of both. All right. Are you a morning person or a night owl? What's the expression? I'm neither. I'm like an exhausted pigeon. I'm neither. I'm just like I'm just an exhausted pigeon going through. So I'm getting out of night, morning. I'm all around the time, morning, night. Neither lately. Okay. This seems to be a good mixture as well. Night. Pretty good balance. I don't think I'm one or the other, to be honest. Yeah, I don't think I'm one or the other. I'm just kind of there. Next. Okay, so this one I found interesting. Would you rather have a 4-day work week or work, I'm assuming 5 days, or I don't know, I assume working 5 to 6 days for 2 months straight and then having 1 month off entirely? Like, are you a 4-day work week so you get a 3-day weekend, or would you rather to work consecutively for 2 months and then get a full month off? 4-day work week. Maisha, 2 months. Maybe that's what she's gonna do next with ACC. Who knows? It's coming, guys. It's coming. 4-day work week, 3 days at my current job. 4-day. I don't like to work, period. That's a mood. You know, I don't dream of labor. 2 months. Okay, so a pretty good balance, but I think 4-day work week is winning out. 4-day work week. Can I just get paid to live? All valid concerns being raised in the chat. Let the recording reflect all of these things. The next one, I think we have one more. Are you more of a remote worker or learner, or do you prefer in-person work learning? Remote, in-person, okay. I don't have a strong preference for this one either. I mean, I've been remote for the last 2 years, but I do sometimes miss the in-person vibe of like having an office to go to and all of that and being with my coworkers and stuff. Both hybrid, both is a good solid choice. Hybrid. Okay. Got a fair mix of both, and a fair mix either way of one or the other. I think that was the last one, right, Rosanna? That was the last one. So yeah, that was a very quick icebreaker. It was great to hear from everyone what it is they liked, and there's very strong opinions about some things. So really hope that you enjoy the rest of the activities throughout the day and the discussions that we're going to be having. Thank you.
Thank you, Shanique, for this or that icebreaker. So for me, it was definitely tea or Milo. I remember that one. For our work week, yes. So I hope I had some similarities with other persons on the call. So at this time, we're going to move into our first panel discussion for the day.
Oh yeah, Tina.
Yes.
Good girl. Am I a friend, Tina? Should be a good moderator too.
Okay, I think somebody got caught on microphone just by accident, but I heard the comments and I appreciate it. Thank you so much.